Hi, I'm Jessica Hall, TV radio personality. I'm sitting here with Dr. Kim from Facey Medical Group. Dr. Kim, you're a pediatrician. I'm about to have a baby. Everyone's wondering, how do you go about picking the right pediatrician?
Well, there are many ways of doing it.
Would I be able to interview you beforehand just to kind of have a feel and make sure that we're the right fit for each other and for my child?
Certainly, yeah. Okay. Every mother or mother-to-be has a right to choose her own pediatrician. So you can definitely that you have to check in and then ask a lot of questions. And then you can see several pediatricians, and then you can choose one of them, whoever that fits on your needs.
So what's the main thing that I should look for in a pediatrician as a first-time mom?
Okay, usually the pediatric disease are pretty acute. Acute disease means like you're sick, you have to be seen. So I would ask a pediatrician that how soon can I get the answer from you or reply from you about my question. Okay, so because some doctors are very busy, they cannot answer right away. And then sometimes it's very important questions that you want to have answer right away. So I think I would definitely ask pediatrician that how soon can I get the answer from your office, either by nurse or by doctor.
So communication with the nurses and the doctors is like the number one thing I should look for.
Right.
Okay.
And another thing is like make sure they have an on-call doctor, because some small groups they do have on-call doctors, but there are not too many people there, so that sometimes the nurses answer the calls in the middle of the night. But we do have enough number of doctors, and we can answer the questions in the middle of the night anytime. So getting quick answer is very important.
What's the most common asked question that people just have a fear of or just are a little nervous about? Like I know mothers, I mean, I know I had tons of questions. Like for me it was vaccines. You know, I didn't want to just kind of vaccinate all at once. I wanted to slowly do it, and I wanted to do my research on it, because I mean, are there some that you don't technically need, or there's some, I mean, how do you...
You're talking about like in general that what the mothers usually are fearful about?
Oh yeah, definitely.
Okay,
I mean, especially first-time mothers. You know,
Yes, vaccine is one of them. But nowadays, like it has been proven that the vaccine is very safe, and this is not from me, but from the government and from big organizations. The American Academy of Pediatrics that we go by, and then they said they've tested so many times and so many years, and they're definitely that they proved that vaccine, all the vaccines are safe. Otherwise, it won't be on the market, right? So
but taking your time, is that something like this? Is actually, it was a concern of mine. I didn't want to just bring my daughter in and get vaccinated all at
together.
Once.
Oh, I see. Okay. So in my practice, that I give mother's choices or father choices, that you can split the vaccines. So we call it staggering the vaccine schedule. That I allow them, but I really encourage them to get all the vaccines within time frame. So for instance, like instead of getting 3, getting 1 today, and then come back in 2 weeks or 2.
Great.
So that way that you can kind of ease up that fear.
I think it's more on the parents than the child.
Exactly. So but again, that it's been proven that getting 3 shots at the same time, again, that really hurts mommy, daddy, and the baby also. Maybe probably more than just 1 shot, but more than when they get 1 shot. But still, that the effectiveness and side effect wise, there is no difference between getting 3 shots and 1 shot.
There isn't.
There is no. Only a little bit more painful. That's all. But they still recommend to do it at once.
Good to know.
but it's okay. It's up to you. It's up to moms and dad. But they have to come more often to get the shots.
Yes, right? I hear that. Because I hear that pediatricians want to get all the shots in just in case they don't come back, and then
right.
Yeah,
that's true too.
Yeah, I don't mind coming back.
Yep. Another fear that probably most fearful things that mom or dad go through, especially first parents, are fever. What if my child has fever and then we can't control it, then fever will make his brain bad, or some kind of complications of fever, like any kind of further infection of the fever. That's kind of fear and dilemma of the parents. Should I go to ER in the middle of the night, or should I wait until next day? What if something bad thing's going on, and then next day it will be too late? So that's probably the second most fearful thing.